Anyway, I will go ahead and get started with the review, the introduction of this section on principles of One Health. In this section, we're going to discuss really just what it says, the overall principles of One Health, at least in the context of how WHO uses the term One Health. We also will provide an example, and that example is antimicrobial resistance, or AMR. During this section, we'll talk about the importance of taking multisectoral and multidisciplinary approaches, which we call One Health approaches, and the rationale behind that current public health issues, for example, MERS and AMR and rabies and influenza, are too complex for a single sector to address alone, to control alone, and really that we need multiple sectors involved to manage these complex issues. We'll also provide basic information about how participants can we can provide basic information about that hopefully will help the participants in this discussion series to engage in the other sections of the discussion series, the other two sections. And hopefully the principles that we discuss in the first section will be reflected in the other two sections. We talk in this section also about having standardized mechanisms for communication, coordination, and collaboration in countries, and also that a first step is making sure that all of the relevant sectors to a particular question or a particular problem are part of the conversation from the beginning. We discuss why there is no single definition for One Health, and about why we don't believe that there needs to be a separate institutional structure in a country for doing One Health. Rather, that the goal is to build strong sectoral systems, public health systems, animal health systems, environmental health systems, and then establish these mechanisms for working between them. We talk about trust, about building trust and being trustworthy, and how that's critical to the success of One Health collaborations. And then in the example, we reflect these principles for antimicrobial resistance as described by Liz Taylor in her video. AMR is a great example because it's very, very complex. It's a problem for animal health and for public health. For many reasons, it's a great One Health example. Not only do both animals and humans need antibiotics for control and treatment of clinical disease, but also because resistance develops in both animals and humans, especially with inappropriate use of antibiotics. And so slowing the spread of development and decreasing future development really requires full engagement of many, many sectors, not just animal health, but others, environmental health sectors that are involved in both in the use of antibiotics and the spread of resistant bacteria, but also sectors such as finance and development sectors and the trade and the agriculture sectors, which all play roles in this. So we hope that this section will raise some questions, raise some discussion about the basics of One Health and what it means to take One Health approaches. Thanks very much.
Thank you, Liz. Can we proceed with Stefan?
So I think that with the audience we have in this webinar, there is no really need to explain how it is important during an outbreak to be together with the different forces of the country. And the problem is that very often things are going so fast that it's too late to be organized if it is not already done in advance. So what we need to build is capacity for the different sectors to interact in peacetime, but it's terribly difficult. It's difficult because of challenge linked to the different type of perceptions, different way of working, different way of speaking. And all that, again, need to be prepared very well in advance. As my director, Genael, explained with his anecdotal story about the hunters and Ebola, during outbreak there are many actors, NGO, specific professions, but also people involved in the health system of the country. And we will try to use the best that we can from these different sectors to answer to an outbreak. So we are just talking about capacity building here, but capacity building, especially from the international organization, we have different tools. I mean, I just take an example of, for example, the lab. FAO has developed a lab mapping tool to assess the capacity of a lab. Then the WHO has a tool for reviewing the capacity, the quality of the laboratories facilities. And then the PVS laboratory tool from the OIE is in fact a system that helps to work on the network of the lab. All these tools can be together. But more globally, what we try to do is to also engage or to use the strengths of the big frameworks.
Stéphane, sorry to interrupt, but you have moved away from the mic. We don't hear you very well anymore.
I don't remember where I am. Anyway, in addition to some specific technical tools to assess capacity in countries, we also have more global tools that help us to review the capacity of the systems. And the most important one are the ones that are linked to the global health security, to the IHR, to the international health regulation. So I don't think that I need to further develop on the IHR. Just to remind you that it's a framework that is a mandatory and legal framework to develop capacity to detect and to answer, to respond, and to assess to outbreak of public health importance. Based on that, what we will try to do, and this will be illustrated during the seminar, is that we will try to use the strength of this framework and to also see how the other sectors, not only public health, but also veterinary sectors and other sectors can contribute to the implementation of this IHR. We do that because as the IHR has been endorsed by all member countries of WHO plus few others, this gives us a very strong incentive to engage the country in developing their capacity. So, in fact, this problem of IHR and response to outbreak becomes a quite political issue because of the implementation of the IHR, but also because, and especially after Ebola, there is a big debate about ensuring global health security global health security at the planet scale. So, in fact, in this seminar, we will see how OIE, FAO, people working in the global health security agenda, people working on food safety, use this framework, use the IHR, to strengthen the effort to build capacity in countries.
We will now give the floor to Dr. Jeffrey Gilbert.
My name is Jeff Gilbert. I'm, as you've heard from Yolanda in the introduction, I have a sort of animal and human health background. And for me, there is no other way to do things but in this collaborative approach of One Health or EcoHealth or whatever you'd like to call it. I've worked with both WHO and FAO in the past. So it's a real pleasure to be part of this. I look forward to constructive discussions and also to add to my own learning as well as, for those who participate, because we have a good group of experts already lined up in both the English and French side. This one, which follows the other two sessions, I see as a very practical. It's the cold face. It's going past the theory that we will hopefully understand more fully after the first two sessions, what's available and capacity building and so forth. And it brings me back to a quote that I always use from, it might be apocryphal these days, but apparently in the early days of One Health, this Indonesian participant listened to a very interesting One Health presentation, and then his question was, where is One Health beyond your PowerPoint? So where is it practically happening? And this session is going to give us the opportunity to see the practical, the experiences, the lessons learned, the positive things, the challenges, what has gone wrong. And two things that are close to my heart are sustainability. Is this going to keep going beyond donor interest? And then also being able to sort of measure. We still are challenged by when somebody says, so prove your One Health is better than working separately or whatever what we're doing currently. So I would like to see us discuss those in the sessions. We have a good range of expertise on both English and French sides, so we'll be looking at specific examples like Rift Valley fever, then the tools like risk assessment, and then practical sort of joint response experiences. And so what we'll do is we'll run those separately in English and French, but I hope to, by following both, to sort of mix and cross-fertilize so that we can share the information as widely as possible. Thank you very much.
I would just like to give you the names of the countries that are going to share their One Health experience. This is Bangladesh, Central African Republic, Kenya, Mauritania, Morocco, Uganda, and Vietnam. So some of them are done in English and some of them are done in French. So, but you will have both documentation in French and in English.
I'm a little bit confused about One Health. I think environment is very important and largely determine what kind of communicable diseases that can affect human or animals. Is it part of One Health concept? If the answer is yes, what about the other component of environment that can cause health-related threat like radio and chemicals? Is chemicals or radioactive materials included in One Health concept, and we have to address them? Thank you.
Thank you, Ahmed. We are still in the introduction, but I will give the floor to briefly respond.
Sure, thanks. No, that's actually an excellent question, and it's probably the first question that will come up in every one of these conversations. So thank you. The answer is One Health includes, the way WHO sees it, One Health is an approach, and it's not a thing. One Health is an approach we use to tackle a complex problem, no matter what that problem is. So if that problem needs expertise from chemical experts, then they're included. If it doesn't, they don't have to be included. The idea is that the problem or the question or the research project or whatever it is that you're doing defines the people that need to be in the room. So we can even imagine that there would be a One Health approach taken to a problem where there's no public health impact. So it's just maybe climate, maybe mosquitoes, maybe water and animals, and maybe wildlife, wild animals, or maybe not wild animals, and maybe livestock or just wild animals. And those are the experts you need for that problem. In that case, you may not need public health there. Does that answer your question?
Thank you.
For Nitish?
Yes, this is Nitish here. From Bangladesh, we 3 persons contributed to the interview. So Professor Mahmoud Rahman may not be available tomorrow. He is little engaged with some meeting, but we all other 2 persons will be there. That's what I wanted to tell you. Over.
Okay, thank you. Anybody else who would like to ask questions? To give everybody an opportunity, but I think you can still raise your question by sending email to IHR@WHO. In the next week, you will receive the documentation of the interviews apart from viewing the interviews in YouTube, you will receive a documentation of all the interviews, both in French and in English. So we will also put in there the schedule, but at the same time, the required viewing or reading for that particular session.
Thank you, Yolanda. I want to give a quick word of thanks to all the interviewed experts who have contributed the interviews that you can now access on Facebook. No, not on Facebook. Also on Facebook, on YouTube also, and LinkedIn, I believe also. So thanks very much for your contribution. So invitation to participants to go view the interviews and start the discussions. Thank you so much for your participation. Tomorrow we'll have the same session, but in French this time.